Raymond, acid gases, toxic metals, new compounds, dioxins, and furans. And as Raymond also pointed out, these are coming out in the form of nanoparticles, very tiny particles. And here is something, this is probably the single most important thing for you to understand on toxic air emissions. There is no regulation for any incinerator in the world for nanoparticles. They are not measuring the nanoparticles, they're not accountable for nanoparticles. They regulate the particles coming out of incinerators at 10 microns. In Europe, they're talking about bringing that down to 2.5 microns. But all of these are like cannonballs compared to the nanoparticles, which are a fraction of a micron. There's an excellent article about this written by Stéphanie Cormier, Environmental Health Perspectives, in June of 2006. And in my view, nobody should entertain an incinerator until the serious questions raised in that paper are answered. I have seen not one single reply yet from the incinerator industry. Nanoparticles are not efficiently captured by air pollution control devices. They travel long distances and they remain suspended for long periods of time. Especially in the situation of Raymond, I would underline what he said about the funnel. It will just be sitting there for years and years. And they penetrate deep down into the lungs. Now, they not only penetrate deep down into the lungs, which is a problem, but these particles are so tiny they can cross the membranes. So they get down to the lungs, straight through the lung membrane into the bloodstream, and then they're distributed to every tissue in the body, and there they can enter every tissue in the body, including the brain. They can cross the blood-brain barrier, and here's an electron micrograph showing a particle in the brain, and it contains lead, barium, chromium, iron, and silicon. You really don't want that stuff in your brain, and certainly not your children's brains. Dioxins and incineration. This is a short summary of what I've got on a longer presentation, longer PowerPoint. You're welcome to have that. I'll leave it with the folks here. They put it on their website if you want to. It goes into the chemistry, the biology, the health issues of dioxins. But here's just a quick summary. The major concerns. Number one, dioxins accumulate in animal fat. If there's anybody raising goats or chickens in this area, watch out. You won't be able to, you shouldn't eat that food, that fat. We did a calculation in 1987, gives you some how long I've been doing this. 1 litre of cow's milk gives you the same amount of dioxin as you would get if you breathed the air next to the cow for 8 months. The dioxins steadily accumulate in human body fat. The man cannot get rid of them in his or his lifetime. They just steadily accumulate, but the woman can get rid of dioxins by having a baby. So here's the situation. This to me is the most serious thing. In the 9 months of pregnancy, the dioxins will be mobilized with the fat and will transfer from the mother's body to the fetus, at which time the concentration in the fetus increases astronomically. And why is that significant? Because dioxins interfere with fetal and infant development. Why? Because they interfere with hormones which regulate infant and fetal development. In fact, dioxins interfere with 6 different hormonal systems: male and female sex hormones, thyroid hormones, insulin, gastrin, and glucocorticoid. In particular, we're talking about interfering with sexual development, interfering with mental development, and also not on there is impact on the immune system. Dioxins interfere with fetal. There's Linda Birnbaum, who's excellent, has written an article here, The Developmental Effects of Dioxin. There's a brilliant summary as of 1995. A whole book is written on called Our Stolen Future by Theo Cohen, basically talking about the problem when we produce man-made chemicals which interfere with hormones. Why is it such a problem? Answer: because hormones function at parts per trillion levels. And so you don't need much of a man-made chemical to have a profound effect on the function of those hormones, which are there to regulate development. Now, the Institute of Medicine, which is part of the National Academies of Science, did a study in 2003 on ways to decrease exposure to dioxin. And they said that fetuses and breastfeeding infants may be at particular risk from dioxin due to their potential to cause developmental, immune system effects, etc. They recommended for a high public health priority on reducing dioxin-like intakes by girls and young women long before pregnancy. Don't wait until you're pregnant. How do you do that? So they say substitute low-fat or skim milk for whole milk for your girls, and foods lower in animal fat. So we got to the point that we are really suggesting draconian changes in the diet of our children. That seems to me to be a bit of a crisis. And this is not just kids that live near incinerators or traffic or industry. So here are the conclusions on the dioxin part of this. We have too much dioxin in our food. No question about that. We have too... If food was a project by Aquilini or somebody, and they sought to get approval, it would be rejected. We would not be allowed to consume the food that we do based upon the standard risk assessment. We have too much dioxin in our babies, critical. And we shouldn't be putting any more dioxin into the environment if we can possibly avoid doing so, and incineration is an avoidable source of dioxin. Other dioxin-like compounds, we're not talking about just dioxins. PCBs, there are 209 of those. Polybrominated biphenyls, there's 209 of those. Bromanated furans, there's 135 of those. Polybrominated dibenzodioxins, there's 75 of those. Mixed brominated and chlorinated dibenzodioxins, there's 5,000 of those. Polybrominated diphenyl ethers, there's God knows how many of those. Polybrominated and chlorinated naphthalenes, nitrogen and sulfur analogues. We're talking thousands and thousands of substances, and we've hardly begun to measure the emissions in incinerators. We've just focused on the top family of dioxins and furans. Incineration is poorly and unscientifically monitored. You need three things to protect the public. One is strong regulations, but the best way that you can get strong regulations to protect yourselves and your babies is to get those regulations, put a hole here and a hole here and a rubber band and make them into face masks. Because you need three things to protect you and your children. You need strong regulations, you need adequate monitoring, and you need tough enforcement. Now, as far as adequate monitoring, you've heard already, there is no monitoring for nanoparticles. And I think you have some idea, perhaps, of the enforcement capacities of the British Columbian government. If any link is weak, the public is not protected. You are the best protection. Right now, you are the best protection. Stop this facility from being built. That's your protection. Incineration only... This is how they monitor dioxins, if you could believe this. Wait for it. This isn't Monty Python. This is a Canadian regulatory law. The incinerators are only measured once a year, usually with a month's notice given to the company. Their data is collected under ideal conditions. They collect 3 6-hour tests, and that means that you have 18 hours of ideal data being used to extrapolate to 8,000 hours of real operation. If you believe that that gives an adequate monitoring of the dioxins coming out of the incinerator, well, we're back to another author, Alice in Wonderland. Worse still, they then compound this scientific atrocity with a mathematical atrocity of taking an average of those 3 numbers instead of doing a 95% upper confidence interval. This is ridiculous. I've had this out with the Ministry, Ontario Ministry of the Environment in Ontario. I've had this out with them. They know this. I've told them this umpteen times, but they say this is the way to go. Even though in Europe now, in Belgium and Germany, they have a system for measuring 2-week samples. They collect samples not for 6 hours, but for 2 weeks, and then 2 weeks, and then 2 weeks, and then 2 weeks. The whole year they get 26 2-week samples. So they actually get 8,000 hours of real data, not 18 hours of idealistic data. Incineration is extremely unpopular with the public. You already heard this. 300. No new incinerator permitted in the United States since '95, and the last one permitted in Canada was even earlier than that. There has been intensive opposition to new incinerator proposals in France, Belgium, Canada, Germany, Italy, UK, and many other countries.